طيب دكتور تحب تبدأ إن شاء الله؟
إن شاء الله.
طيب بسم الله الرحمن الرحيم. الحمد لله رب العالمين وصلى الله وسلم وبارك على نبينا محمد وعلى آله وصحبه أجمعين. I'd like to welcome you all to yet another one of AMA's webinar series events. Tonight, inshallah, we have our distinguished guest, Dr. Shabib Alhadher, to talk to us about staying healthy in Ramadan. You all know Dr. Shabib. You might have listened to one of his khutbahs at one of the many masajid around the valley or attended one of his lectures. He's also a pediatric cardiologist here in the valley, and mashallah, very good one at that. In fact, I have a personal experience with him. My son, when he was born, he had to see a cardiologist, and Dr. Shabib took very good care of us. Jazakallah khairan. So with no further delay, Dr. Shabib, if you want to take it from here, inshallah.
Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Inshallah, we'll start the presentation, inshallah.
Brothers and sisters, I would like to ask you to please mute your phone if you're not speaking. That way the noise doesn't, everyone doesn't hear the background audio, inshallah. Jazakumullah khair. Fadl, Dr. Shabib.
الحمد لله رب العالمين والصلاة والسلام على خاتم الأنبياء والمرسلين سيدنا محمد وعلى آله وصحابته أجمعين. I welcome you all. I hear lots of background noise, so please, brothers and sisters, if you can mute your phone or your laptop or your
I'll just go in quickly and mute everyone, and then inshallah I will.
Okay.
Okay. Unfortunately, go ahead, Doctor.
Okay. Sure. I know this Ramadan is going to be a different Ramadan, not like the others, and we ask Allah subhanahu wa ta'ala to make it easy on us and to relieve the stress that we're going through, and to remove the pandemics from all over the globe, inshallah. Inshallah, we'll talk about how to stay healthy during Ramadan. It's very important and very crucial for everyone with heart conditions or other conditions, taking medications, and they need to know what to do and how to receive during the month. Next slide. Next slide. So we know that every Muslim should fast Ramadan. Allah subhanahu wa ta'ala has prescribed fasting not on Muslims but also all the nations before us, as Allah subhanahu wa ta'ala said in Surah Al-Baqarah, يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. Or you who believe, fasting was prescribed for you as it was prescribed upon those before you, that you become righteous. Next, please. And we know that every Muslim should fast. Fasting is obligatory upon every Muslim, male and female, who has reached puberty and able to fast. We know that it is it is. Can you please mute your brothers and sisters?
I mean, there's people, but it's okay.
For all the listeners, please can you mute your phone?
You have to walk the dashes.
There is someone on the line that needs to mute. I'm unfortunately unable to mute as host because I'm displaying my screen at this point, but please mute your line. Thank you.
It is a golden opportunity for Muslims to get rid of sins and to get closer to Allah. And we know that it is an intensive disciplinary course. And every part of our body should fast. Fasting. Next, please. Allah subhanahu wa ta'ala mentioned in the Quran, in Surah Al-Baqarah, that وَأَقْتُوا خَيْرٌ لَكُمْ, but fast is better for you. So we will see that fasting is better for the body. Next, please. Some people they think that when the month of Ramadan starts and there's days when it's gonna be over, but there is a say from I believe someone is talking. Please, can you mute your phone? Can you mute your phone? Anyone who's shared with us, can you please mute your phone or your computer or whatever device that you're using? There is one, Safa Hadi. Safa Hadi, can you mute your phone? Thank you. Yeah. And so Muhammad Ali, may Allah have mercy on him. He said one time about Ramadan, don't count the days, but make the days count. So whatever you do during Ramadan, those are the ones that that are going to count for you, inshallah. Next, please. Next slide. And we know that fasting is a protection and a shield for the person, as the Prophet said, fasting is a shield. Next, please. Some benefits of fasting, and you look at the literatures, and there are books written about that, and some research about the benefit of fasting. But I'm going to summarize some of these benefits for the sake of time. We know that it helps in the treatment of numerous chronic diseases. It can reduce the risk of obesity, psychological pressure, high blood pressure, high blood sugar, high cholesterol and triglyceride levels, kidney problems, and also in some heart conditions. Next, please. Next slide. It also showed from some studies that it helps to reduce stress and anxiety. And as I have a reference for that. If anyone is interested, you can go on that reference and read more details about what they said about the importance of fasting to reduce stress and anxiety. Next, please. They found that fasting and associated acts of worship like Taraweeh, the evening mass prayer during the holy month of Ramadan, promotes communication and social interaction among people. And also fasting is believed to result in the release of endorphins, which are our feel-good brain chemicals that the brain is producing to calm the person down and help with the stress. Next, please. There are some, myths that people they thought about. If you fast, things may harm your body, and so one of the good books that if you want to read more about it, by Jack Goldstein's Truth Over Disease by Fasting and Natural Diet. Fasting does not cause the stomach to shrink, atrophy. It does not paralyze the bowels, as some people think. It does not deplete the blood. It does not produce anemia. It does not cause the heart to weaken or collapse. And it does not produce deficiency or malnutrition, as some people may thought. It does not reduce resistance to diseases and does not harm the teeth, nervous system, glands, or vital organs. And it does not weaken the vital powers or cause mental disturbances, as people may thought. Next, please. Next, please. And now we'll come to the rulings of the sick person during Ramadan. We know that Islam offers an exemption to the sick from observing the fast during the month of Ramadan, but some people may be able to fast, but they have to be careful with their health condition, and they have also to connect with their doctors, as we will describe in the coming slides. Next, please. Yeah, so there are people who force themselves to fast despite the risks, while others, irresponsibly take advantage of the privileges granted by Islam for the sick, and even if a simple disease or health issues that doesn't require them to leave fasting, they will do it because assuming that they are sick enough. So we need to be in the middle, and it has to be a balance in between. Next, please. We know that Allah subhanahu wa ta'ala made Islam easy for us in many ayat and ahadith of the Prophet sallallahu alaihi wasallam. Allah subhanahu wa ta'ala said, وَمَا جَعَلَ عَلَيْكُمْ فِي الدِّينِ مِنْ حَرَجٍ. He has chosen you and has not placed upon you in the religion any difficulties. So if you find any difficulties in the act of worship, that is not from Islam, and you have to review the issue. Next, please.
Not placed upon you in religion and definition.
And Allah subhanahu wa ta'ala also said in this ayah, يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. Allah intends for you ease and does not intend for you hardship. Next, please. There is also a beautiful hadith of the Prophet sallallahu alaihi wasallam.
Can you take a picture?
He said, إِنَّ اللَّهَ يُحِبُّ أَن تُؤْتَى رُخَصُهُ كَمَا يُحِبُّ أَن تُؤْتَى عَزَائِمُهُ. Allah subhanahu wa ta'ala, the Prophet sallallahu alaihi wasallam said, Allah likes his permissions to be fulfilled as he loves his commands to be obeyed. So the permissions that are given to the sick person, to the one with chronic diseases, should be taken as an act of worship and not as a waste. Some people, they think that, oh no, I'm healthy enough despite having uncontrolled diabetes or uncontrolled heart conditions, and they start getting worse during the month of Ramadan. Allah subhanahu wa ta'ala said, فَاتَّقُوا اللَّهَ مَا اسْتَطَعْتُمْ. So keep your duty to Allah and fear Him as much as you can. So as much as you can, as Allah subhanahu wa ta'ala mentioned. Next, please. The month of Ramadan is a great opportunity to focus on bringing back a balanced and healthy lifestyle in your life. So keep in mind that Ramadan is a month of fast, not feast. Next, please. Now we'll come to the diseases as approached by scholars and how we categorize them. So there are two types of illnesses or diseases that we should know. The first one is the acute or short-term diseases or illnesses where recovery is expected shortly, such as like pneumonia, strep throat, gastroenteritis, and others that within 2 or 3 days, it may resolve. And if the person is certain that fasting will make the illness worse as directed by your doctor, or will delay the recovery, then it's okay to break the fast and make up the missed days after Ramadan. This is the type, the acute or short-term illnesses. The chronic or long-term illnesses, where recovery is unexpected. Examples of that, like diabetes, kidney problems, heart problems, others that require, everyday medications or procedures or surgeries. So these are, in this situation, if the person is told that fasting will affect his or her condition, then the person should not fast and should take that as as an act of worship and give the fidya, or the ransom compensation, by feeding a poor person 1 meal every day. It's estimated to be half a sa', approximately 3.3 pounds or 1.5 kilograms of food. Scholars, they said they may give it all at once. If it's given in money or monetary things, you should calculate it based on the land you live in. In the USA, we estimated that, or scholars estimated that, to be around $8 to $10 per meal.
What's the topic again?
And also, you have to check with the local imam in your masjid to be able to, to give you the accurate fatwa in that regard. The next, please. Ahmed?
أيوة دكتور.
Do you have the slide, please?
Oh, it's not showing?
Yeah. Someone got into the... The next slide will talk about why you need to see your doctor before Ramadan. If you wait until Ramadan starts, that's too late. You have to start before Ramadan starts. For those who have chronic illnesses and take medications on a regular basis, they need to see their doctors whom they trust, like whether a Muslim or non-Muslim doctor, before Ramadan starts, for the following reasons. I'll explain to you these reasons. We're trying to get the slides to show you, so if you wanted to, the one before that, yes. Thank you. To ensure your ability to fast. So you need to check with your doctor, your family doctor, who knows you very well, who knows your history, who knows your sugar level, who knows your blood pressure, who knows your details about you, and he will tell you whether you are okay to fast or not. To adjust your medications, dosages, if necessary, because when you start fasting, you may not use the same dosages of medications, and also the schedule of the medications that you're taking. If you're taking a medicine 3 times a day, you won't be able to take it during Ramadan. And in this case, your doctor can change that medicine to maybe equivalent medicine that's taken twice a day. So you can take it after iftar and before sahur, instead of taking it 3 times a day. And also we have now some of the medications are extended release or sustained release medications that you can take it only once a day, and it will cover, it will have the same efficacy of the other medications. So you need to discuss it with your doctor for this reason. Also, to discuss with your doctor about the side effects of medications that may interfere with fasting. If you're taking certain medications that may be affected, so they need to, your doctor needs to explain to you that in details. For close monitoring of your health condition throughout the month of Ramadan, and especially for those who are diabetic, they need their blood sugar to be controlled throughout the month of Ramadan, or if your blood pressure is high and needs to be monitored during the month of Ramadan. So these are very important things that you need to discuss with your primary care physician before Ramadan starts, or with your specialist if you see someone in that regard. Next, please. So my advice is to avoid scheduling your regular annual medical dental routine checkup during the month of Ramadan. I would advise you to do it before Ramadan starts, so to make sure that you are fit to fast. Next, please. Now we're going to talk about the medications that we use and the passages or the routes that we use, and we give those medications, and we'll take them one by one to explain which ones that can affect your fasting. Next, please. I just wanted to clarify this first, that what I present includes answers of some scholars' opinions and assemblies of Islamic fiqh jurisprudence, and it's not it's not coming from me. So these are questions we presented to these institutions and some scholars, and we get their answers that I will share with you in the upcoming slides. Next, please. So oral medications. With the oral medications, there is a general rule. Anything that goes through the mouth and reaches the stomach will break the fast. So you don't need an imam, you don't need a scholar, you don't need to call anyone, is this gonna break my fast or not? Anything that you take by mouth will break the fast, period. Next, please. Now, the type of medications that we use now, and we're talking about the oral medications by mouth, or we call them PO, per os. Those includes pills, tablets, liquids, syrups, and definitely these will break your fast, as we mentioned. Now, we have other pills, tiny pills, we call them the sublinguals. We give them to some patients with angina, with chest pain, and we instruct the patient to take this pill and to put it under the tongue, so not to swallow it. It gets dissolved within seconds under the tongue and relieves the chest pain of that person. And these in general will not break your fast, provided that you don't swallow it. You don't swallow the pill. If you swallow the pill, it's not gonna help you. It has to stay under the tongue for a few seconds in order for it to work. But a caveat of that, if you having some chest pain, that person who takes this sublingual or under the tongue medications, if you have chest pain and you take one of these pills and you relieve your chest pain, and after 5 minutes, chest pain comes back, and even worse,
Shabib,
then you don't keep taking these pills. You need to call 911 and to go to the ER, because you may have a heart attack. Don't rely on on these pills to keep swallowing them. On the skin, when it comes to the skin, like ointments, cream, patches, these are in general will not break your fast. So if anyone puts cream or ointments that has medication on it or uses patches, this will not break your fast. And the private areas, we use suppositories pessaries and enemas. These will not break the fast according to the scholars. Inhalers, puffers, nasal sprays, they are okay or permissible to use according to the majority of scholars. I will explain this more later on, but just take it as it's permissible in most of the scholars, and I'll elaborate more on that in the next few slides. Drops, we have eye drops, nose drops, and ear drops, and we have injections, intravenous, intramuscular, and subcutaneous. We'll explain these in details in the next slides, please. So when it comes to the drops, you know, the amount that you put in your eyes or your ears is very little. We're talking about 1 drop and or 2 drops the most, and you put it in the eye. Although there are some communications between the eye and the ears along to the nose, to the back of the throat. These are very tiny amount that's not gonna break your fast, inshallah. So majority of the scholars, they said, or most of the scholars actually, they said it won't break your fast when it comes to the eye drops and the ear drops. When it comes to the nasal drops, there are 2 different opinions among scholars. Next, please. The next slide, please.
Yes, I think there's just a delay maybe in the line. Let me go back and forth again.
Okay. There are 2 different opinions we said among scholars for the because of one hadith where the Prophet ﷺ told one of the Sahaba, "أسبغ الوضوء وخلل بين الأصابع وبالغ في الاستنشاق إلا أن تكون صائما." The Prophet ﷺ said, "Perform wudu well and make the water goes between your fingers and sniff water up into the nose deeply unless you are fasting." Because of that hadith, some of the scholars, they said, you know, with the nose drops may get into that area that's a gray zone, and it may get directly into the throat and may affect the fasting. But other opinion, they said it's okay because it's only a very small amount, which is 1 drop or 2 drops, and usually it dissolves locally. And for those who are very congested, like when they wake up in the morning, they cannot breathe, and they need their drops, they need their inhaler, they need all these measures to allow them to breathe. Then it will be okay for them, to take with that opinion of the scholars that it is okay to use that the nasal drops or the nasal spray. My advice for those people to use these nasal drops or nasal spray, when they use it, they should not sniff in the medicine, because you need the medicine to work locally. So if you try to sniff it in and take the medicine out of the area, then you lose the purpose of the effect of that medicine on the congestion. So it's better just to spray or to put the drops and lift the neck up, as you see in the picture there, and just leave it for maybe for a few seconds. It will work locally and never don't sniff it in. I hope this is clear, inshallah. Next, you can take notes if you want, so we can answer the questions later on, inshallah. There is a fatwa about the nasal spray by Sheikh bin Uthaymeen and Sheikh bin Baz. I took it from them. They said using sprays for allergies does not invalidate the fast according to the correct opinion, whether they are administered through the nose or through the mouth, as they are in the form of vapor and do not contain any solid materials that enters the stomach. I hope this explains what I mentioned earlier. Next, please. Next slide. Injections. When it comes to injections, so we have 3 types of injections. We have the subcutaneous injections, these are tiny needles. They just inject through the skin, and we use them like those needles, tiny needles used for insulin. Another medicine is called Lovenox, or a blood thinner, that's used for some people with blood clots, or those with some cardiac valves that we replace them with mechanical valves, or some other diseases also we use it. These are okay. They will not break your fast if you take them. So if you take the insulin shot, it's not gonna affect you. Intramuscular, that means we're talking about now deeper injections. We're going through the muscles. Those examples, the antibiotics, painkillers. Some people, they take HCG, vitamin B6, B12, not for nourishment, but for problem with the paresthesia. We call it like a numbness of their legs, and to strengthen their legs so they'll be able to walk, and also to relieve the pain. Example of that: vaccinations, immunizations, allergy shots. These are okay, will not break your fast if you take them while fasting. A big example of vaccination is the meningitis vaccine that people, they take before going to Umrah. It's okay to take it while fasting, but unfortunately this year it will be difficult for the Umrah and may not be available. And we ask Allah subhanahu wa ta'ala to, to relieve this distress that we are going through, and to relieve and to remove this pandemics, inshallah. The third type of injections we're dealing with is intravenous, through the veins. So we're going deeper now through the veins. 2 types of intravenous medications we use, like antibiotics and other medications. These are okay to use and to give to the patient. It will not break the fast. The second type is used for nourishment or nutrition, like IV fluids, blood transfusion, supplemental vitamins. These will break your fast. As a matter of fact, if you are at the level, that you need IV fluids, that means you're sick enough to go to the ER for dehydration. Blood transfusion also definitely will break your fast. Next, please. Next, please. Other things, it's like kidney dialysis, where the blood is taken out, cleaned, and put back with some chemicals or nourishing substances such as sugar and salt added. This is considered to break the fast by the fatwa given from the Lajna Da'ima in Saudi Arabia. And also supplemental oxygen is okay to use. It will not break your fast. Next, please. Now, when it comes to procedures, sedation that would require sedation, anesthesia, what they said, the scholars, they said, if a person who is unconscious, so it's like, for instance, a person has like seizure, and for a minute or two, without fasting, and that person woke up and become conscious, he or she can continue to fast if he or she is okay. He doesn't need to go to the ER or anything. So what they said, the scholars, they said, if a person who is unconscious is awake for even a moment of the day, his fast is valid. Yeah, as long as he made the intention to fast from the night before. So, so for that reason, you know, some people, they use this for the sedation if they are going through a procedure for maybe for half an hour or 15 minutes or something like that. I mean, a short period of time, they wake up, they don't want to break their fast.
Sedation.
But, there is a caveat of that. I'll explain to you in the next slide, please. Just to give you just what the scholars, they said. These are some of the procedures that may be needed during Ramadan. And you can see from the pictures here, the one, you know, the scope, how they do like removing a gallbladder with those scopes, laparoscopic procedure, or appendectomy through the scope. Or we see the heart on the right side. Those are like how they put the balloon and they put a stent there in the arteries to relieve the chest pain or the heart attack. Also CT scan, the bottom there on the left, or MRI, and also another procedure like endoscopy, like going to check your stomach, or a colonoscopy from the bottom. Next, please. So what the scholars, they said, and this is a very nice reference if you want, by Sheikh Muhammad al-Munajjid. The book's name is 70 Matters Related to Fasting. You can download it from online also, it's available. He mentioned that insertion of a catheter into the veins for diagnostic imaging or treatment of blood vessels, the heart, or other organs. These procedures, basically, that I mentioned earlier, in general, they're not gonna break your fast. So, the general rule that these procedures will not break the fast. However, next slide, please. I have some reservations on these procedures. You know, most of these procedures, because I witnessed some of them, I performed some of them. So most of these procedures will require, inserting a venous catheter and flush it with saline fluids, using an IV fluid hanging there, just in case something, goes wrong during procedure. Patient, needs resuscitation. So you need to give that person, medications or to give IV fluids or even blood or something like that. The possible sedation, anesthesia that's going through the procedure, and as I said, flushing with normal saline IV fluids during the procedure, because sometimes with these endoscopy, when they look inside the stomach, they have to flush the esophagus, they flush it, they use lots of fluids to flush, so things will get into the stomach of the patient for sure. And the same way, the cleansing the bowel. And so because of that, my advice is to schedule these procedures outside Ramadan if it is not an emergency. If it's an emergency, then you have the excuse and the permission to break your fast and make that day that you broke it outside Ramadan, inshallah. Wallahu a'lam. Next slide. Now, some of the chronic illnesses that we deal with that we're gonna discuss in details. Migraine headaches, diabetes, heart disease, kidney problems, cancer patients, and breathing issues and stomach issues. Next, please. Migraine headaches, if it's not affecting the person to the point that that person, will start vomiting, will need strong medications to control it. You have to discuss it first with your specialist, how well you can handle fasting while having severe headaches. Usually, when the headaches improved in 2 to 3 days after getting used to fasting, and eating a balanced food and drinking plenty of fluids may also help. Minimizing stress level is also highly recommended, as the Prophet ﷺ gave us the advice. If someone is coming to even to fight with you, you just say, I'm a fasting person. Try to avoid any fight or any quarreling with others, and just try to stay calm. Stress increases levels of adrenaline and cortisol, leading to increased blood pressure, drops in sugar level, hence worsening your headaches. So you need to control the stress. Taking a nap will help. Usually also sleep well at night. That may help also to control it. You may take your medication at suhoor time. That lasts throughout the day, the extended release ones. And there is a new medicine, it's called Zomig. It's a nasal spray. It's an alternative. You can discuss it with your specialist. You can use it while fasting. It's, as we discussed it there earlier, that nasal spray is not going to affect your fasting. But for those with severe migraine headaches, I would say you have to seek medical advice from your doctor. Next, please. This is a very helpful handout. It's about diabetes and Ramadan. It was authored by the International Diabetes Federation. You can find it online in a PDF. For those who have diabetes, it goes over all what you need to do during Ramadan if you have diabetes, and how to stay healthy throughout the month of Ramadan. Next, please. So in general, what they found from the study is that diabetic patients who are controlled by diet alone can fast, and hopefully with weight reduction, their diabetes may even be improved. And diabetics who are taking oral hypoglycemic agents, the medications we take by mouth to drop the sugar level, with the dietary control should exercise extreme caution if they decide to fast. These patients should consult their medical doctor for dose adjustment. I'll talk about that in a second. If they develop low blood sugar symptoms in any time of the day, they should end the fast immediately. Next, please. This is another medicine that's been used. It's called metformin, commonly used for people with pre-diabetes or those with the elevated hemoglobin A1C. That tells you about the blood sugar level, or how your body is metabolizing your sugar for the past 3 months, how your body handles the sugar. And it's a very good mean or tool for us to see if you are prone to develop diabetes or you have diabetes already. This is very important. I mean, for this medicine, whether you need it or not, if your hemoglobin A1C, it's borderline, it's not elevated, and sometimes just by fasting you may not need even to use it. So you have to discuss it with your doctor, and your doctor will tell you exactly what to do. Next, please. Yeah, when it comes to the diabetics who need insulin or need medications to control their medications or their sugar level, you need to speak with your specialist about, changing the dosages. You need to tell your specialist, if he's a non-Muslim, that you fast and how long you're going to fast and what does it mean. And you can share with them some of these resources I pointed out earlier. And also I have some resources for anyone who's interested or needs those resources. I have some articles. You can share it with your non-Muslim doctors to educate them about Ramadan and how to deal with a fasting person with diabetes, and how to adjust the dose of insulin, how to adjust the dose of the pills that are taken for decreasing the blood sugar. Next, please. Yeah, this is one of the articles I referred to earlier by Dr. Shamsi Basha. Next, please. Next, please.
Yes, doctor. I think I am.
Yeah, this just to talk about details from that article. I don't want to go to the details, but in general, this is what I explained earlier, that you need to consult your doctor. So that's why what they recommend is pre-Ramadan medical assessment and counseling. That is, you will find it all over these articles that you have to see your doctor before Ramadan starts. If you wait until Ramadan starts, that is too late, brothers and sisters, especially those who are affected by diabetes. Next, please. Yeah, next, please. Yeah. Elderlies with diabetes, they have to be very, very careful. I had the chance to speak with one of the geriatric specialists, and I told him, give me an advice so I can add it to my slides. He said, they should discuss with their doctors if they are able to fast, and majority are not able to fast. That's a fact. If able to fast, may use the long-acting insulin, the Lantus, right after iftar instead of bedtime outside Ramadan, to prevent morning hypoglycemia, the drop in the blood sugar, hypoglycemia, and also to monitor glucose reading closely, and to hold any insulin if glucose is less than 100, and also not to use these medications that we use, glyburide, to drop the blood sugar. It should be avoided during Ramadan in elderly because of increased risk of hypoglycemia, because it can drop the sugar very low and they can go into coma, and unfortunately some people may die from that. So it's very serious, and you have to discuss it with their doctor. I mean, for if you take care of your parents or elderlies, then they need to see their doctor before Ramadan starts if they decide to fast. Next, please. For the inhalers, they're basically compressed air that reaches the lungs through the windpipe, the trachea, and does not reach the stomach. It is like inhaling steam and smoke, as scholars they said. So there are two different opinions among scholars, by the way. But all scholars, they have one opinion that taking these inhalers is not the same as eating or drinking. The organization of the Islamic Conference, International Islamic Fiqh Academy, they allow this to be used, although some scholars, they said because what's inside them, this can have some particles or things that can stick to the tongue and then can be swallowed and then can affect the fast. But I would say if you are in need to use that, you have the choice. And the Prophet ﷺ, if there are two opinions, he will choose the the least one or the easiest one to make it easy on his ummah. So alhamdulillah, we have the other opinion that it's okay to use. So I'm with the okay, but if you don't feel comfortable with that, then you have to ask your imam about that, inshallah. Next, please.
He's talking about different medications if it will break your fast or not.
I'm sorry?
Yeah, he's talking about nasal spray. Like half the scholars are saying like no, it like affects because it goes like to the back of the throat. So some scholars say no because you're technically not swallowing it through the throat, and the other why?
Yeah. The reason behind that is they said, and some of these medications, they do have particles or materials that may they're not just air, which is true in some medications that we have, like the powder ones that we use that have steroids in it. Those are the ones, that I agree that can affect the fasting. And you can see here with the Pulmicort and the Nebulizers, some of the scholars, they mentioned about this, that it may break the fast because of those particles that can be swallowed and can affect the breathing. If the person is at that level that you need the nebulizer, you need oxygen, you need steroids, you need that means your asthma or your bronchitis is not under control, and you may need something else, even steroids IV or even steroids like prednisone by mouth to help you to overcome the asthma attack. So those are they have the permission to break their fast. They don't have to wait for this fatwa because they're already sick. Yeah, but we're talking about using you start wheezing a little bit. You use the inhaler, the puffer, the Preventil, or you use the Ventolin, and you just use 2 puffs, and that's inshallah will not affect your fasting, inshallah. Next, please. So we move to heart disease. Of course, I mean, a lot of people, they suffer from heart conditions, and these people, they have to be very careful. This is another very nice article, the cardiac patient during Ramadan and Hajj by Dr. Hassan Shamsi Basha. Very important article. If anyone is interested in the article, I have a copy of that. I can provide anyone wants to have more details. Next, please. Next slide. Patients with controlled hypertension can safely fast. However, patients with resistant hypertension should be advised not to fast until their blood pressure is reasonably controlled. Patients with recent myocardial infarction, like heart attack, unstable angina, recent cardiac intervention, that they had cardiac catheterization to balloon putting stents to their coronary arteries, or cardiac surgery, they should avoid fasting, at least for this next 6 weeks after the procedure. Next, please. I will have the list of all these, high-risk patients that, you will find them in the article also. Those patients who experience recurrent chest pain, or patients with heart failure who experience fatigue, lack of energy, and shortness of breath, as they need frequent dosages of diuretics, those water pills that they use. These are patients at higher risk and should not fast. Patient who has suffered heart attack and they just had recent procedures or open heart surgery, as we mentioned, for at least 6 weeks. Patients with the heart valve problems, especially if the heart valves are narrowed, we call it stenosis, or infected, inflamed. Those patients on blood thinners or anticoagulants, they may not be able to fast. Patients on malignant arrhythmias like rhythm problems, they need to be on medications to control their rhythm problems like AFib, unless it's well controlled and you need to take your medicine only once a day, and then they're okay. But in general, if they have malignant arrhythmias that's uncontrollable and they need several medications to control it, they should not take the risk and fast. Patients with heart conditions that require constant professional observation, that you need very close monitoring by your cardiologist, then those patients should not fast. Next, please. I think these are some explanation of the things that we went through. Can you we can skip the slide, please? Next. Yeah, for any heart patients, we said during Ramadan, 4 small meals will be preferable instead of having 2 large meals that can put more strain on the heart to work harder. Yeah. Next, please. Blood pressure, high blood pressure. Also, they have to consult their doctor about how controlled your blood pressure is. If it's not well controlled and you need to take your medication, especially water pills, and you cannot avoid them, then you have to speak frankly with your doctor and explain about fasting, and they have to be very careful, basically. Yeah. Next, please.
Sorry.
Yeah. Okay. And for those with high blood pressure, of course, I mean, we said they have to avoid for any heart conditions. Avoid fatty food, and avoid too much salt, and try to eat healthy and exercise regularly, inshallah. Yeah. These are slides that will be available for anyone who wants more details, inshallah. And just for the sake of time, I wanted to go through them quickly, inshallah. Next, please. So actually, studies have shown that physical activities performed by Muslims during the Taraweeh prayers helps to reduce high blood pressure. And as a matter of fact, some patients with high blood pressure may get better, during Ramadan if their blood pressure is not too high or malignant. They need like 4 medications to control. I'm sorry, I can't hear the question. Can you repeat that? Okay. Next, next, please.
Oh, I did go 1 slide. 1 more.
Yeah. Well, yeah, it's basically these are things that I discussed earlier. Yeah, kidney problems. Patients with acute renal failure, kidney failure, if they are in acute phase, and your doctor said you have worsening of your kidney function by more than 30% of the GFR, you should not fast. Those patients can deteriorate quickly, and they can go into coma, and other organs will shut down, and they can have lots of problems. Patients with chronic kidney disease, the early stages, could fast with cautions mentioned, as mentioned by their nephrologist. Patients with stage 4 or 5, kidney disease that's categorized by their, doctor. They will tell you this: you are in stage 1, stage 2. So you have to, talk to your doctor. And I spoke with some of the kidney specialist, nephrologist, about recommendations. Next slide, please. So they said patients should discuss with their doctors again. Same advice from all physicians. If their medications could be switched to once daily dosing, if not possible, then they take them regularly with sahur and iftar, and after consulting with their provider. Patients are advised to have baseline blood work before beginning of the month of Ramadan. Again, you see, not just for the heart, not just for the stomach, but also for the kidneys as well. They're all requesting the same thing, same advice. You find it across the board. Depending on the severity of their kidney function, they may not be able to fast. So next, please. Next, please.
I'm sorry, there's a delay in the line. It seems to be. Yeah. So very important for patients with kidney disease. Also, they said should not skip sahur. This is very important. Blessed meal that the Prophet ﷺ advises to keep to avoid body weakness, bearing in mind that they need more calories than individuals in good health. So it's very, very important for those people to be careful with that. Each kidney disease has its own dietary requirement for Ramadan. So you need to discuss it with your doctor if you are affected by any of those kidney diseases, because they will explain to you things that you should avoid during in your diet, actually, to prevent worsening of your kidney condition during Ramadan. Next, please. Did it switch?
Yeah, next. Yeah. So basically, patients with uncontrolled. Oh, before that. Go back.
I'm sorry, there seems to be a delay in the line. I'm on the next slide, the chronic kidney disease and transplant.
Yes, before that. Before that. Yeah. So patients with uncontrolled or poorly controlled diabetes, with associated chronic kidney disease, should be encouraged to control their sugars first before they start Ramadan, to avoid increase in the sugar or decrease in the sugar level. For kidney dialysis, as we mentioned earlier, this is the machine that takes the blood from that person. He goes like 3 times a week to have sessions. So these, when that person is getting dialysis, his or her fast will be validated. So it's not. They should break their fast. They cannot fast while getting their dialysis, as mentioned by the scholars. Chronic, kidney disease patients should avoid high potassium and phosphorus diets. So that's why you have to be careful, even with dates, tamr, all those fried foods and nuts, cheese, soft juices, and drinks. So that's why you need to talk to your doctor to give you a list of all those dietary items that you can consume during Ramadan. Drinking plenty of water is very crucial as well. Those anti-rejection medications that's used after kidney transplant, you have to be also careful with that, and you have to discuss it with your physician about whether it's okay for you to take it, because sometimes you have to take those around the clock, and you cannot delay those medications. They may give you some, crucial advice to be careful with that. For people with kidney stones, they recommend to drink lots of fluids, low salt, low oxalates, like you find it in tea. So less tea, drinking tea during Ramadan. Otherwise, sometimes they can have more kidney stones and they can have problems while fasting because of the dryness. Next, please. For cancer patients, again, they have an excuse, not to fast. Majority of them, they are not fit to fast, but you have to check with your physician, with your oncologist, the cancer specialist, because they have to take chemotherapy, that treatment through IV, and some medication, some radiation, and that will make them weak, and they need IV hydration. And also they have intractable vomiting. They sometimes self-induce vomiting to relieve the pain, and they have chronic pain that can be very difficult to manage, and they have to be on medication. So they have an excuse. So Allah subhanahu wa ta'ala give us the permission. The Prophet ﷺ give us the permission, and we have to use those permission, and they are also an act of worship. Keep in mind, when you follow these permissions, you are worshiping Allah subhanahu wa ta'ala. Next, please. Oh, you don't want to reach to that level. You can see that person ate too much, they forgot themselves, and they just, things like the moment that say Allahu Akbar, they start, eating left and right. That is not good for any part of your body. So Ramadan is a month of fast, not feast. Next, please. Next, please. You like that picture, I guess, huh?
And it seems there's a delay in the line.
Okay, I thought you liked that picture. I mean, yeah. So we have the ayat, the Hadeeth of the Prophet sallallahu alaihi wasallam, that how filling the stomach is not good at all. I don't want to go into that details because everyone knows these. Next. Next, please. Yeah. This is a beautiful hadith of the Prophet sallallahu alaihi wasallam.
Does he meet there in the morning?
Yeah. Next, please. Yeah. So indigestion, or dyspepsia, we call it. It's it has lots of symptoms. You can next please. This is the when the people they start having upset stomach. They start having
I don't think a lot of people know that.
Before that, so like they have only fullness during a meal. They feel fullness after a meal. Discomfort in the upper abdomen, burning sensation, bloating, nausea, and even sometimes vomiting. So these are some of the symptoms that can be presented with this problem with the indigestion. Next, please. So although fasting during Ramadan should improve or control these symptoms, but the studies have shown that more people suffers from indigestion during Ramadan. They found from one study in Morocco in 2014 that 20% of people, who fast, they will complain of indigestion. And the reason we know that's consuming the way that we consume food, and we forget ourselves, and we eat left and right, and put more burden on our stomach to handle, and people they start have lots of problems. Yeah. Next, please. Yeah. Next.
The picture is taking some time to load. Let me.
Okay, that's good. Some dietary advice.
Do not skip suhoor.
Do not skip suhoor. That's very important. Because
increase the length of your fast, which is not advisable in this.
Some, at least some energy during the day, so to avoid dehydration and fatigue. Drinking as much water as possible between iftar and sleeping time. Avoiding salty foods during iftar and suhoor, because salt, will make you thirsty, and you need to drink, and during while fasting you cannot drink. avoiding caffeinated drinks like soda, caffeine, coffee, tea, anything or energy drinks, all these things that can, can aggravate the thirst, and also they are like water pills. They are like diuretics. So it makes the person pee more, and you lose fluids, and you get dehydrated easily. And try not to consume heavy fatty foods, which often cause the disturbances and causing these symptoms of indigestion. Next, please. Again, avoiding refined carbohydrates and sugar, in like white bread, white rice, sweets, and pastries, and try to to eat healthy during the month of Ramadan. For suhoor meal, it is advisable to eat proteins, oil, complex carbohydrates such as beans, ful, the fava bean, and drink have a cup of juice, maybe fresh juice, or have a piece of fruit. Break your fast by your iftar meal with a simple, easily digestible food, maybe like dates, as the Prophet ﷺ advised us, and something simple, and then you can go and pray, and then you can eat after that your meal, but don't eat too much, because you won't be able to pray Taraweeh. Next, please. Things that you should limit during Ramadan, and we all probably know, fried and fatty foods, very spicy foods, and things that has extra salt, contains foods that contains large amounts of sugar, and also the as we discussed it earlier, the caffeine. It's very, very important to keep this in mind to stay healthy, so you won't have stomach issues or bowel issues during Ramadan. Next, please. This is the advice of the Prophet ﷺ, is to eat the dates. And this is your ideal diet in Ramadan, to break your fast with dates and eat after prayer. Make healthy choices and avoid overeating during Ramadan. Don't skip suhoor. Follow the 3-meal rule. If you can do it 4 meals, that's fine. They're just small meals. Consume plenty of vegetables and fruits, and reduce your intake of sweets, and drink sufficient amount of water. Next, please. Next, please. Yeah, we said that about the dates. And there's for people with gastritis, means inflammation of the stomach, or ulcer. For people who have ulcer, this is a very nice also review article. If anyone is interested, I have these articles if you need more details. Yeah, next, please. So as we mentioned earlier, those symptoms of indigestion or dyspepsia. So the major thing for us is to eat in moderation, and elimination of foods that can trigger reflux. For some people, they have acid reflux, and hopefully those people will be okay to fast if they take their medications during during sahur or during iftar. To keep in mind that just as of note here is the Zantac or ranitidine was withdrawn from the market, so be careful not to use it for now, because they are not prescribing it because of some side effects that they found, and unless they clear it, so don't buy Zantac from over the counter, or if your doctor forgot to give you that medicine. Yeah, you will find it in the news. For ulcers, patients in general who takes medications regularly for their ulcer may be able to fast, because when you're fasting, you're not eating too much, so your stomach is not producing much of the acid and the enzymes. So you resting your stomach, that will help in general your stomach. And that's why, I mean, also for people with inflammatory bowel disease like Crohn's disease or ulcerative colitis, they're not at high risk, you know, if they fast. So they are okay. They are okay to fast if their conditions is under control. Next, please. Next, please. Commercials. Yeah. So liver disease, you know, most people with liver disease will be able to fast, but I'm going to elaborate more on this in the next slide, please. There are two main types of liver disease. They're what we call the fatty liver disease and inflammatory fatty liver disease. Patients with the liver disease are generally divided into three groups. Those, you know, the first group is those with chronic inflammation from a virus like hepatitis B, hepatitis C, and other chronic liver disease. If their enzymes are stable, liver enzymes are stable, and your doctor said you are okay to fast, hopefully they will not have any issues unless their liver enzymes are very high and they're not under control. Then if your doctor said, no, you cannot, you cannot fast, so please follow the advice of your doctor. The second group of these people, of these patients, you know, with simple cirrhosis of the liver, with normal liver function. These patients are normally able to fast, provided they do not experience any complications while fasting. And the third group includes the patients with advanced cirrhosis of the liver, and these patients are generally not able to fast due to the required medications that they need on a daily basis. Next, please. So patients with ascites, you know, like fluids in their belly, or they are in coma because of their liver disease, or they vomiting blood, and they have late stage fibrosis. These patients at high risk and should not fast at all. They should be, you know, excused from fasting. This is the hadith I talked to you. Next, yeah. The hadith the Prophet ﷺ mentioned about the pre-dawn meal, the suhoor. تسحروا فإن في السحور بركة. Eat suhoor, for in suhoor there is barakah, blessings. Yeah. Next, please. Yeah. Next. السحور أكلة بركة فلا تدعوه ولو أن يجرع أحدكم جرعة من ماء فإن الله وملائكته يصلون على المتسحرين. The Prophet ﷺ said also, suhoor is a blessed meal, so do not omit it. Even if one of you only takes a sip of water, you know, because of the blessings that you have, and you get the blessings, and that you know, the malaika, the angels will send the blessings on those who eat suhoor. Next, please. When to eat suhoor, you know, this is one of the hadith. One of the Sahaba said, you know, we counted, you know, how long it was between the adhan and suhoor, between adhan al-fajr and suhoor. He said about like reciting 50 verses, 50 ayat of the Quran. So you can judge maybe 15 minutes or, you know, 20 minutes, you know, not to wait to the last minute before when the mu'adhan is making adhan and you continue to eat. And that's not, you know, but although you are okay to, you know, while the adhan is going, you know, you can still drink. And for some of the scholars, they said it's okay. Next, please. Yeah. For vomiting, we're almost done. Yeah, so vomiting. Whoever, there's a beautiful hadith of the Prophet ﷺ said, whoever vomits unintentionally does not have to make up the fast later on. But whoever vomits on purpose does have to make up the fast. So if it comes on its own, you cannot control it, and the vomit comes out. Just try and make sure that you don't swallow it back, and just rinse your mouth, and inshallah you'll be okay. But if you have to induce vomiting, like those patients we said with severe headaches or with cancers, they have to do it to relieve the stomach upset. So those people are excused anyway. So they should be careful fasting if they need to get to that level. Next, please. Quit smoking. You can see how we crush that. This is the time for all of us, to take advantage for those people who still smoke, not just a cigarette, but also hookah, shisha, whatever you call it in your country. It is bad. Smoking is bad for the body, for every part of the body. Cigarette smoke contains more than 45 poisonous chemicals that can cause cancer. Cancer everywhere. Start from the tongue to the throat, to the lungs, the trachea, you name it. And then stroke, heart disease, all the stuff, So you don't need more than that. So quit smoking. It is a golden opportunity for all of us who smoke, is to basically to quit and to make it, your commitment during this Ramadan, inshallah. Next, please. Exercise while fasting. It is recommended, not to sit on the couch and not to do anything. You need to do some exercise that will help also to increase your circulation, help your immune system, and just go for a walk, go for just brisk walking, do anything, stretching to exercise to help your circulatory system. Next, please. Bleeding. So nose bleeds, skin bleeds, glucose check. You check. You take just 1 drop, 2 drops to to check your blood sugar. Will not break your fast. Blood draw will not break your fast if it's a small amount. A large amount, people, they may start fainting, and be careful with that. If the person faints when exposed to blood, or when they try to draw blood from him or her, they should avoid that test while fasting. Blood donation, it will break the fast according to the scholars, because they're taking lots of blood from you, and also it will make you weaker, and then you faint, and then first thing they will give you after you faint is to give you juice or water to wake up and to so please, it's okay. I mean, you can do it outside Ramadan, before Ramadan, after Ramadan, or after you break your fast in the evening, if possible. Blood transfusion, as we said before, it will break the fast. Cupping or hijama, there are 2 different opinions among scholars. Some said it's okay, and some said not okay while fasting. And both, they have a hadith from the Prophet ﷺ. I'm not going to go into that details, but for those who wants to know more details, you can search it. You can find the scholar's opinion about that. Next, please. Dental issues. Again, it's you can use the siwak, toothpaste, and toothbrush, and during Ramadan, it's not gonna void your fasting. Simple procedures, tooth extraction, dental filling, and teeth cleaning. All these things are, if they're not an emergency procedures, I would say try to avoid them during Ramadan because of the issue with the bleeding, and they put lots of fluids in your mouth. You won't be able to sometimes to avoid swallowing it, and so if it's not an emergency, please try to schedule it outside Ramadan. Next, please. Women issues, pregnancy and breastfeeding. We have, alhamdulillah, in Islam, as we said, Islam is easy, and give us lots of exceptions and exemptions for some people, as Allah subhanahu wa ta'ala mentioned in the Quran. And in this beautiful hadith, you can see the Prophet ﷺ mentioned, in Allah Azza wa Jal, وضع عن المسافر شطر الصلاة والصيام وعن الحامل والمرضع. So Allah subhanahu wa ta'ala has lifted the obligation of fasting from the pregnant and breastfeeding women. So they don't have to push themselves, too hard if they cannot tolerate, that. For the breastfeeding mother, if she insists to especially the first few months, when the baby needs lots of milk, if she can pump breast milk during the night and feed the baby with a bottle during the day while she is fasting. Another suggestion, if then she wants to use a formula during the month of Ramadan, but it's totally up to that person. She should judge that according to her condition. But there is an exemption for them to, if they cannot tolerate fasting, then they are excused, and they are okay to break their fast, and then to compensate for those missed days after Ramadan. So when they are ready for it. Next, please. There are some concerns that fasting may affect how well a baby grows in the uterus and the womb of the mother, and that fasting may be linked to a premature labor in some studies. That's why the risk of that, because Ramadan, if it happens during the summer, the weather will be too hot, puts pregnant women at greater risk of dehydration due to low fluid intake, and this could induce premature labor and subsequently lead to premature or preterm births in some studies. Next, please. It is important for, no, before that?
Yes, I went back, but it doesn't seem to.
Yes, for the sisters who wants to fast while pregnant, they should consult with their doctor first to make sure that they are not at high risk. And then pregnant women who are willing to fast during Ramadan and they are okay with their doctors, they should take these precautions and also follow these instructions to take rest frequently throughout the day, get the right nutrients and calories when they break their fast each evening, and consume up to 3 liters of water between iftar and suhoor, and avoid sweets and other sugary snacks usually consumed after iftar. So try to follow those instructions. Also may help also them during fasting. Next, please. It is very important for those with other associated conditions during pregnancy, like gestational diabetes or diabetes while pregnant, and high blood pressure or anemia, they should be advised not to fast because things may get worse while fasting and they can have lots of complications. So for those patients, they should be very, very careful during if they wanted to fast, and they have to check with their doctor first, these are some of the warning signs from some experts. If they are not putting on enough weight or are losing weight, if they become very thirsty, urinating less frequently, and they develop severe headaches or other pains or fever, they become nauseous or start vomiting. These are ominous signs, very serious signs that they should break their fast and they consult with their doctor, right away. Next, please. And for the, as we mentioned earlier, for the breastfeeding, usually it's recommended for the first 6 months if mom wants to feed the baby. It is very important for the baby to get all these nourishments from mom at least for 4 to 6 months, according to the American Academy of Pediatrics. They recommend that, and most of the specialists, they do recommend that. Mothers of older babies who are already taking supplementary food or in addition to mother's milk, they can fast, and because they can give their babies other type of food, and they are not, they're not, obliged to feed like all the time, because they can not just the breast milk, but they can have other sources of calories. Next, please. Again, the mother should be also careful who is nursing, should drink enough fluids and should get rest. And if she is fasting during the day, and should drink lots of fluids, closer to 13 cups a day or 3 liters, and drink milk, drink or eat dairy products, and to basically stay healthy and eat healthy, and try to avoid anything that can affect her during while breastfeeding. Next, please. Bleeding now. This is the last slides, inshallah, 1 or 2 slides. Yeah. Next. Yeah. No, go to the bleeding. Sorry. Yes. So bleeding for the women issues, bleeding. There is a term. It's called istihada, which is a non-menstrual vaginal bleeding. This, according to the scholars, it does not break the fast. This happens, after the menstrual cycle stops, or in between menstrual cycles. Some sisters may experience this spotting or some blood. If she's confirmed that this is not menstrual cycle and it's not the time for it, then this is called istihada. And this blood should not break the fast, and she should continue to fast. Vaginal examination, if the woman needs vaginal examination, this will not break the fast. Inserting intrauterine devices, scopes, or pessaries, these are not breaking the fast if it's performed. Abortion and miscarriage. Next slide, the last slide. Yeah, for this, for the abortion of miscarriage, if a pregnant woman miscarries and the fetus is formed or has the discernible outline of any part of the body, such as a head or hand, her blood, it's called nifas, and she will be treated like the one who gave birth. However, she passes something that looks like a blood clot or a chewed piece of meat that has no discernible human features. The bleeding is called istihada, and she has to fast. If she is able otherwise, she can break her she can break her fast and make it up later on. Once she becomes clean after having an operation to clean the womb, it's called DNC. She should fast afterwards after the cleaning. So that's according to the fatwa from Al-Lajna Daima in Saudi Arabia. And this also included in that book I told you about, 70 matters related to fasting. Next, please. I think that's all about what I have. Allahumma innaka afuwan tuhibbul afwa fa'fu anna. Next slide, please. And inshallah, may Allah make it Ramadan Mubarak on all of us. Inshallah, we get into Ramadan with this pandemic is removed, and we'll be able to get together, inshallah, and get basically to the masjid, idnillah. That's my hope, inshallah. But inshallah, we have to make dua. This is the golden opportunity for us to make dua, to ask Allah subhanahu wa ta'ala to help us all and to help cure our diseases and to help us, with all our brothers and sisters who suffer from these diseases, to give them speedy recovery and to help them throughout Ramadan, inshallah. I will stop here. If you have any questions, any comments, I'll be happy to take those, inshallah. Jazakumullah khair for listening.
Jazakallah khair, Dr. MashaAllah, very informative and very packed with lots of information. If anyone on the line has any questions, please unmute your phone and or your connection and ask your question, inshallah.
Alaikum salam.
Is it permissible to brush your teeth, like using a paste and brush during fasting?
What is the question? I'm sorry, I couldn't hear it.
So the question is, is it okay to brush your teeth with normal toothpaste and a toothbrush during the mornings of Ramadan?
Yes, I mentioned that for the dental issues and using the swak or using the brush and with the toothpaste. The scholars, they said it's okay to use as long as you don't swallow it, just release in your mouth and you spit it out. So you don't swallow it, inshallah. Like we do, we don't swallow it unless person likes that taste of it. Yeah. So try not to swallow it, inshallah.
Thank you.
Well. Any questions about the medications or the details of some of the diseases, and if you need something personal, you don't want to share it here, you can always discuss it with me privately. I'll be happy to. Anyone needs any of the references, I do have those references. We will post this presentation, inshallah, online with AMA. They will, inshallah, they will take care of it, and you can also watch it and share it with others, inshallah. Is that correct, Brother Ahmed?
Yes, inshallah, we'll do that, inshallah.
Yeah. For those who missed it, or for those who didn't catch what I was saying, some of it, I have detailed slides. I was trying to skip some of the slides because they have too much details. For those who need more details, they will find it in the slides, inshallah. Any other questions? What is the question? I'm sorry. Ahmed, are you able to?
I'm not sure it's a question, Doctor. I think it's just the line is not muted.
Oh, okay.
Any other questions on the line?
You can switch to my face or not?
Both should be showing.
Oh, okay.
Everyone can control, they're on top of each other, inshallah.
Okay.